The truth about the O shot. Now, I'm sure you've heard of all the different discussions on whether or not the O shot is actually effective. In today's video, we'll be diving into the O shot. The O shot, short for Orgasm Shot, is a non surgical medical procedure that aims to improve sexual function and satisfaction in women. Stick around for a bonus at the end for another way that the O shot can help a woman stay sexually healthy. Today, I'm going to explain how the O shot works and answer questions that you may have about this sexual wellness treatment. I'll be talking about how it works, what it does inside of your body, how to know if you're a good candidate, what the treatment options are and what they look like, the results, how much it costs, and what the side effects are. The chapters of this video are in the description below in case you wanted to skip to anything. Don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of the O shot? Would you ever get it? Why or why not? Have you gotten it? If you have, what was your experience like? I'd love to hear your thoughts. So how does the O shot work? Well, the O shot involves using platelet-rich plasma, or PRP, derived from the patient's own blood and injecting it into specific areas in the vagina and clitoris. The idea behind the O shot is that the growth factors and healing properties of PRP can improve blood flow, stimulate tissue regeneration, and enhance sensitivity in the treated areas, ultimately leading to improved sexual arousal, stronger orgasms, and enhanced overall sexual satisfaction. How do you know if you're a good O shot candidate? Well, determining whether or not you're a good candidate for the O shot typically involves consulting with a healthcare provider who specializes in sexual health and wellness. If you experience sexual concerns or challenges such as difficulty reaching orgasm, decreased libido, vaginal dryness, pain during intercourse, or dyspareunia, or other sexual dysfunctions, you may be a candidate for the O shot. The O shot was originally designed for patients who also have urinary incontinence. So if you accidentally tinkle when you cough or sneeze, the O shot is right for you. Generally, you want to be in good overall health without any contradictions to the procedure. Your healthcare provider will review your medical history, current medications, and any existing health conditions to determine if the O shot is safe for you. Candidates for the O shot typically have a desire to improve their sexual function, satisfaction, and overall sexual weakness, or help with urinary incontinence and reducing the chances of wetting themselves. If you're seeking ways to enhance your sexual experiences or reduce urinary incontinence, the O shot will be beneficial for you. The best way to determine if you're a suitable candidate is always to schedule a consultation with a qualified healthcare provider specializing in sexual health and offering the O shot procedure. During the consultation, your provider will assess your specific concerns, discuss the potential benefits and risks, and determine if the O shot is appropriate for you based off of your individual needs and your medical history. So what does the O shot treatment procedure look like? How many times and how often should you do it? Well, before undergoing the O shot procedure, you'll have an initial consultation with a healthcare provider that specializes in sexual health. During this consultation, your provider will discuss your concerns, medical history, and treatment goals to determine if the O shot is suitable for you. On the day of your procedure, your provider will apply a topical numbing cream to the genital area to minimize discomfort during the injection process. A small amount of your blood will be drawn from your arm, similar to a routine blood test. The blood sample is then processed in a centrifuge to separate the platelet-rich plasma, or PRP, from other blood components. Once the PRP is prepared, your provider will inject it into specific areas of the vagina and the clitoris using a fine needle. The PRP contains growth factors and healing properties that promote tissue regeneration, improve blood flow, and enhance sensitivity in that region. After the injection, you may experience mild discomfort, swelling, bruising, and a little bit of bleeding at the injection sites. These typically subside within a few days. There is no restrictions and no downtime after your O shot. Depending on your individual response and treatment plan, you may need multiple sessions of the O shot spaced several weeks apart to achieve optimal results. We usually treat people first 6 weeks apart, then maintenance treatments every 3 to 6 months. Your provider will discuss the recommended number of sessions and frequency based off your specific needs and goals. It is essential to undergo the O shot procedure with a qualified and experienced healthcare provider who specializes in this treatment and is trained in the way that it was originally designed. Always follow your provider's recommendations and instructions for pre- and post-procedure care to ensure the best possible outcomes. Now, what results can you expect from the O shot? PRP injections can stimulate the production of natural lubrication in the vagina, which can alleviate dryness and discomfort during intercourse. Some women experience stronger and more intense orgasms after undergoing the O-shot, as well as reduced chances of urinary incontinence. The improved blood flow and tissue regeneration in the genital area contributes to more satisfying sexual experiences, as well as stronger muscles, leading to decreased urinary incontinence. Women with sexual dysfunctions, such as difficulty reaching orgasms or low libido, may benefit from the O-shot. It does help improve overall sexual function and desire, leading to a more fulfilling sex life. Now, PRP contains growth factors that promote tissue regeneration and repair, and over time, that injected PRP may enhance the health and vitality of the vaginal tissues, improving elasticity and firmness. While individual results may vary, many women experience long-lasting benefits from the O-shot. Now, some may notice improvements immediately after the procedure, while others may see gradual enhancements over time with multiple sessions. It's best to make sure that you are patient post-treatment. Good things will come to pass. So how much does the O-shot cost? Well, the cost of the O-shot can vary depending on several factors, such as the location of the clinic, the expertise and training of the providers, the number of injections needed, and any additional services included in the treatment package. It's essential to keep in mind that the O-shot may require multiple sessions for optimal results, and we offer multiple package deals and discounts for these treatments. Additionally, remember that you should also have follow-up appointments and maintenance treatments to keep improving your sex life or keep your urinary incontinence at bay. So what are the side effects of the O-shot? The O-shot, like any medical procedure, may have potential side effects. Some women may experience mild discomfort, swelling, bruising, or redness at the injection site immediately after the procedure. These side effects are typically temporary and should resolve within a few days. Less common effects include infection, allergic reactions, or tissue damage at the injection site. It is essential to follow the post-procedure care instructions provided by your healthcare provider to minimize the risk of any complications. As with any medical treatment, it's crucial to discuss your medical history, any allergies, and potential risks with your healthcare provider before undergoing the O-shot. They can assess your suitability for the procedure, address any concerns you may have, and provide personalized advice based on your individual health profile. So remember, not only does the O-shot help women with sexual wellness, but it also helps with urinary incontinence. Urinary incontinence is a common condition that affects many women, especially as they age or after childbirth. It refers to the involuntary loss of urine, which can occur during activities such as coughing, sneezing, laughing, or exercising. The O-shot can help with urinary incontinence symptoms, particularly stress urinary incontinence, which is often caused by weakened pelvic floor muscles. When PRP is injected into the tissue, it can stimulate tissue regeneration and improve the strength and elasticity of the surrounding muscles and tissues in the pelvic floor. By strengthening the pelvic floor muscles and improving tissue health, the O-shot can help support the urethra and the bladder, reducing episodes of urinary leakage and improving bladder control. This can lead to a significant improvement in quality of life for women dealing with urinary incontinence issues. I hope all of your questions about the O-shot have been answered. If you're a woman struggling with sexual wellness, then we would love to help you. Our medical clinics have multiple locations around the country, and we've helped thousands of women with the O-shot. Click the link in the description to book a consultation with one of our experts. Don't forget to like and subscribe. We'll see you next time.